and thank you for joining us for our session titled Trending Issue: Meaningful Research Includes Patients at the Table. My name is Suzanne Ruff, and I'm pleased to introduce this panel session. Professionally, I've been a freelance writer for the Charlotte Observer, and I'm the author of the nonfiction book, The Reluctant Donor. I am a member of the AAKP National Board of Directors, serving as the association's treasurer. I am also a living kidney donor. In my family, over 20 loved ones have battled or are battling a genetic disease called polycystic kidney and liver disease. The disease has claimed the lives of 11 family members, including my mother and a few short months ago, one of my sisters. I am the only sibling who did not inherit kidney disease. People ask me if I feel guilty about that, but I had nothing to do with my genetic makeup. But I do feel a great responsibility, which is why I became involved with AAKP, as did my father 40 years ago. I am obnoxiously passionate about kidneys and supporting families facing rare or genetic conditions which cause kidney failure. I am a staunch advocate for organ donation and living donation for at this point in time, and hope for artificial kidneys in the near future. I often say, when a person has kidney disease, the family has kidney disease. As a family member and living donor, I have had the great opportunity to represent AAKP on various research projects, including being a co-investigator on the Patient-Centered Outcomes Research Institute's project, putting patients at the center of kidney care transitions, also known as Prepare Now. Our work on this project was from 2015 to 2020, and it was an honor to know and work with the patients and other family members like myself. I've also been a key contact for companies supporting AAKP activities, and as a kidney disease subject matter expert on the AAKP Speakers Bureau. More recently, I had the honor of being one of the authors of the article published entitled Engaging Patients and Family Members to Design and Implement Patient-Centered Kidney Disease Research. Over the last 5+ years, AAKP has invested heavily in grassroots and virtual technologies to help patients and their families engage decision makers, researchers, scientists, and other influencers through our Center for Patient Engagement and Advocacy and our Center Patient Research and Education. Through our strategic partnerships with government, academia, and industry, we have been able to connect tens of thousands of new patient voices and their unique patient insights to those responsible for making informed decisions that impact some of the most vulnerable, ill, and underserved populations in the country. AAKP is building our capacities to better organize patients, address inequities, and to make certain patients have an even greater impact on issues related to care choice and innovation. Throughout the speaker presentations, it will demonstrate that AAKP is leading the way in engaging kidney patients, like you listening, across the disease spectrum in meaningful research and introducing you to a number of researchers and professionals who know the true meaning of patient engagement. It is more than a check off the box. It's the ability to put the independent patient voice at the research and policy table where it rightly belongs to drive a far larger and more representative number of patients in efforts that are already shaping the future of kidney disease treatment and public policy. Please join me in welcoming Christine Broderick, Engagement Officer with the Patient-Centered Outcomes Research Institute. I'd like to welcome Ms. Broderick.
Hi, everyone. I'm Christine Broderick from PCORI. Thanks to the American Association of Kidney Patients for having me here today as part of this panel. I look forward to speaking with you all. I'll start today by sharing a little bit about PCORI. We have had the pleasure of presenting at the National Patient Meeting a number of times, so we know that many folks in the audience are already familiar with us, and some of you are already deeply involved with PCORI in a variety of ways. So some of what I share may be familiar to some of you, but I wanted to start by grounding the conversation since there are a number of people in the audience who don't know us as well. And for our old friends, hopefully I'll be sharing some new information that you haven't heard from my other colleagues and that you will find useful in your work, especially as I get into some of what we have learned about engagement and some of our newer resources. PCORI was built on the foundation that patients and other stakeholders must be at the table at every stage if we are to have meaningful research that people can trust and people can use to make important healthcare decisions. The evidence-based information we promote comes from research that is guided by patients, caregivers, and the broader healthcare community. In short, we are working to change the culture of research to be more patient-centered, which is a goal I know that we all share. PCORI funds research on high-impact, high-cost health conditions. We have funded more than 1,800 studies in 49 states, plus DC and Puerto Rico. You'll see chronic kidney disease on this list here on the left, and we actually have updated numbers that aren't yet on this slide. So PCORI has now funded 23 studies on chronic kidney disease, investing $94 million. Whether you're familiar with our research or not, the PCORI Kidney Disease Spotlight is a great place to get a big picture view of the work that we're funding across the kidney portfolio and the important questions that this research is exploring. For example, the pros and cons of different treatment options, how well certain kinds of treatments work, especially for people with chronic kidney disease, and where care and treatment like dialysis is provided. PCORI is working to build a more inclusive research culture within our organization and in the broader research ecosystem at every stage of research. So here you see that engagement across our work goes from identifying research priorities that matter most to patients to changing policy and practice in institutions and clinical practice and everywhere in between. In terms of our funded research, the studies and projects we fund are required to meaningfully engage patients and other stakeholders. And for some teams, this is a new way of approaching their work. We created the engagement rubric to provide more practical guidance to study teams on what engagement and partnership can look like throughout the research process. The rubric is grounded in the principles you see highlighted here: reciprocal relationships, co-learning, partnership, trust, transparency, and honesty. In the coming months, we'll be updating and expanding the rubric with a focus on equity and inclusion. One of our goals is to build the capacity of communities, including the kidney community, to partner in research in robust ways, and the Engagement Awards program helps us to do that. There are a number of funded projects that focus on building capacity in the kidney community to partner in research, for example, by building knowledge of the research process and PCOR, by building infrastructure and online platforms so that researchers can partner with patients and communities, and working together to identify research priorities that are important to patients and guide future PCOR. I know some current and past engagement awardees are in the audience today, and we encourage others of you to explore these projects and explore these funding opportunities on our website. PCORI has now been around for long enough that we have seen some really interesting learnings emerge about engagement, which I'd like to share with you. For the last 10 years, we've studied engagement of patients and stakeholders in virtually every aspect of what we do, and we've developed a body of evidence that is helping to answer important questions about engagement. This information comes from the projects we fund, from outside studies and evaluations, and is also grounded in the experience of PCORI staff, of engagement officers like myself, who work directly with study teams that are doing engaged research. In one recent study, there were 400 distinct examples of how engagement influenced studies across 58 PCORI projects. This study included interviews with researchers and partners and gave us a more in-depth understanding of how and what influence engagement has had in PCORI-funded projects. We have seen in our research something that you all know from personal and direct experience, that there are different ways partners can influence or impact a study. For example, partners might refine or modify different aspects of a study, like outreach materials or informed consent materials, to make sure that they are appropriate for a patient audience that the team is trying to reach. Patients can redirect study activities. So, for example, leading the study team to choose new comparators or new outcomes that are of greater significance to patients, all the way to co-producing, where maybe a PI and partners collaborate or may even share leadership to make decisions about important questions or challenges together. And these are all the ways we've seen engagement positively impact research. So when people ask, why should we engage patients in research? And I know we all get this question all the time. This is why. This is the difference it makes. This is not news to most of us who do this work, but our evidence shows that engaging patients helps to make sure the way studies are carried out actually makes sense for participants and matches their needs and preferences, so that they are willing to participate in important research and stay involved. Engagement of clinicians and patients can help make sure that a study is feasible, that what a study team is proposing can actually be carried out by the clinicians implementing these studies in their practices. And engagement impacts relevance. At the end of the day, are the study results actually useful to people making important and often very personal decisions about healthcare? For example, comparing treatments that a patient is most likely to encounter in their journey and their decision-making process. These results really show you the strong relationship between engagement and meaningful research, and I hope this information will be useful to help ground and support and confirm the work that you're doing as patient partners, as advocates, as clinicians, and as researchers. Again, this is firsthand knowledge for many of you, but I also wanted to highlight some other research on the value that engagement brings to those who are involved. When we surveyed PCORI research partners, this is what they reported in terms of benefits. For example, for patients, improved skills and the knowledge that you're making a difference for other patients. For communities, improved trust and relationships. And for researchers, a deeper understanding of the populations they're studying and trying to help, and a continued commitment to engagement in their future work. We recognize that sharing and implementing these important learnings about engagement requires training and resources. So next I'll share with you a few materials that we hope will help you and your colleagues and people throughout the kidney community to engage in research. Last year at this meeting, my colleague Lisa talked about research fundamentals. This is a free online training that is designed specifically for patients and other stakeholders who are not scientists, to learn the basics of the research process and feel more confident partnering on a research project. So if you're a patient partner looking to get more engaged in research, this is a really great resource to check out. And for other colleagues, this is a great tool to share with your networks and partners. We also just launched a new website called Building Effective Multi-Stakeholder Teams to help researchers and stakeholders build the skills needed to work together better as a team. For example, how to communicate openly and honestly to build trust, how to engage in productive disagreement to identify solutions, and how to share leadership. The engagement tool and resource repository is a set of tools that were actually developed and used by PCORI awardees, both research studies and engagement awardees. So here you'll find ideas and materials that can help to facilitate engagement in research. For example, including committee charters, evaluation surveys, meeting agendas, and a variety of different tools. PCORI also has an Engagement in Health Research Literature Explorer, which is a searchable catalog for peer-reviewed literature about engagement. So if you're looking for journal articles about engagement related to a particular population or condition, this is a great place to start. The Ambassador Program is a great and flexible way to get involved with PCORI and with other supporters to help change the culture of research. It's also a really great resource and a lively community where a lot of information is shared. We have a number of folks from the kidney community among our ambassadors, and I suspect some of you are in the audience today. If you're not familiar with this program, I highly encourage you to check it out. You can visit our website for more information. Finally, here are links to some other resources that you may find useful, whether you're a patient partner or a clinician who wants to know more about what it's like to partner on a research study, or a researcher looking for guidance around, for example, planning and budgeting for engagement. We are also happy to help guide you toward information you might need, so please don't hesitate to reach out to us. Finally, looking ahead, it is an exciting time at PCORI. Right now, we're undergoing a strategic process to define new national priorities for health and a new research agenda. These are the proposed national priorities that were approved by the PCORI Board of Governors this summer. We have been seeking public and stakeholder input throughout the process, and we expect to have a public comment period on the research agenda later this fall or early in 2020. So stay tuned, and if you'd like to stay updated on this work going forward or other ways to work with PCORI, please get in touch. So this is my contact information if you'd like to reach out. Please don't hesitate to get in touch. Thanks for listening. It is always our pleasure to join this amazing event and be able to speak and connect with you all. Thank you.
Thank you, Ms. Broderick. AAKP has been honored to be a recipient of 2 engagement awards and also been represented in all PCORI-funded grants related to kidney disease since inception. Again, thank you to all our panel speakers.